What, my nephew was brought into emergency. He had sliced his eye. And he was seen by a nurse, not a doctor. Can a nurse delegate the same list of...
was he treated by the nurse?
He was treated by the nurse and not seen by a doctor.
Right. What's happened for something like, it sounds like it was a laceration on
his eyebrow,
on the forehead.
Yes.
Okay, on the eyebrow. How old is your nephew?
He's 15 months
15
now.
months. Okay, so not a critical emergency, but nevertheless a problem for that child that needs to be repaired. What most emergency departments have done nowadays is, in order to meet the needs of the community, we've separated the department into different areas, divisions. And there's usually an area called fast track, okay? Or it's sort of an urgent care. Or we treat illnesses that are not acutely life-threatening, things like suturing, okay, broken bones perhaps, mild flu-like
We
illness.
discussed the fast track with Nurse Callan.
Exactly. And so what's happened over the years is that because we've gotten so busy, we have found that either physician assistants, okay, or nurse practitioners are more than qualified to take care of those less serious medical needs and move the doctors into the more critical area. And so in many departments you'll find either a physician's assistant or a nurse practitioner working in the fast track area. So your nephew is probably treated by the nurse practitioner who did the suturing for, you know, his laceration.
So then not every patient will be seen by a doctor? Not
every patient will be seen by a doctor if they are in the peripheral parts of the department, the fast track areas. Those patients still are considered outpatients. We still have the ultimate responsibility of the care being given to those patients. In California, every state has different laws and regulations, but in California, we as physicians supervise the physician assistants or the nurse practitioners. And we have to review their charts, and we have to see so many of their patients that they're seeing with them. You know, we're going to see a lot more of this as healthcare is restructured. We're already seeing a massive decline in primary care specialists coming out of medical school and residency, and we're already seeing the effects of that, meaning that people don't have access to primary care doctors or emergency doctors. If your nephew had to wait for the ER doctor to see him and do that suturing, which may take 15, 20 minutes,
sure.
How do we deal with the heart attacks, the strokes, the major traumas coming in that are continuously pulling us away from those patients? So the only way to do that is to have these ancillary staff professionals that are providing that service.
Which doesn't negate the importance of
Not at all.
A cut or a laceration
Not at all.
or
Not
a
at
simple
all.
bone break.
Exactly.
When somebody comes in and sees you, what kind of questions, and just say, I'm not saying a nurse, I'm saying you, what kind of questions do I need to ask? What kind of things do I need to know? So if I am sitting in your emergency department, what should I be asking you?
Well, as a patient,
yes.
Most importantly, it's more importantly than asking questions, it's when you come into the emergency department, it's making sure you know about your own health. Okay, you'll be surprised how many times I'll walk to the bedside and start speaking to a person like yourself and asking a detailed medical history, and the person has totally forgotten that they had their appendix removed 5 years ago.
But that also gets in the way for your treatment.
Exactly.
Of what possibly
if you come in with abdominal pain, the first thing I'm trying to exclude is if you have an acute appendicitis. And you'd be surprised how many times a person has either forgotten, or they'll have diabetes, and you'll ask them if they have any medical problems, and they'll say no. And their interpretation of that is that because it's treated every day, they don't have an ongoing problem. So I think most importantly is understand your medical problems, understand your medical history, know what medications you're taking, and also know who your primary care doctor is. Okay.
What if I don't have a primary care doctor?
It's a big problem in America today. Then we'll assign one for you and find one for you if you have to stay in the hospital. If you don't have one, that's okay. You don't have to have one, but it makes our job a little bit easier when we're trying to sift through what's wrong with you. I would often tell people the majority of patients coming into the emergency department, at least in the critical area, are not like you, a person coming in who's alert and oriented and able to give me a detailed history. They're usually in a lot of pain. They are sometimes very elderly. They are living in nursing homes, or they're very young, and they aren't able to give us a detailed history or ask a lot of questions. And so we're trying to figure things out by relying on just our clinical acumen, some of the medical history from the computer, what EMS is telling us, and trying to piece it all together to make it fit. My job would be very easy if all my patients came into the ER just like you, sitting there, alert, oriented, articulate, being able to tell me.
Hi, doctor, I have a headache.
Exactly.
And I feel a simple, sharp pain, a simple pain going down my right arm, and I can't move my pinky.
Exactly. It would be very simple for us, but it's not. It's very complicated, and every day is a puzzle. Now, occasionally we are fortunate. We have a patient that comes in, and they have a simple problem. They fell and twisted their ankle, and it's swollen and possibly broken. And they can tell me their detailed history. Or another person comes in, like yourself, who's having some unusual chest pain they haven't had before, and they know that their parents also had heart attacks, and their mom has diabetes, and they smoke 2 packs of cigarettes a day, and they're able to tell us all of that, and it helps us make our decisions. And that's really important because in the ER, we're making very quick decisions, and everything you tell us, every little piece of information, exactly, every piece of data goes into our database, and we start putting that piece of the puzzle in. And everything you leave out also, is left out of the puzzle.
Now that's also what's that piece of the puzzle that's left out. That could be the difference between saving a life and actually losing a life.
It could be critical. It could be critical. The one little thing you may tell a doctor, a patient comes in, he forgets to tell the doctor that on the 5th time that he vomited, he saw blood. Okay? He just says, oh, I've been vomiting all day. Well, if you tell the doctor you're vomiting blood, it changes things for us. We immediately go into a different algorithm. Okay? If you come in and you have a little bit of shortness of breath and you fail to tell the doctor, oh, 2 days ago I just took a long flight from Australia, well, you can certainly have a deep venous thrombosis in your leg that's now migrated up to your lung, and you have a pulmonary embolus or a blockage in your lung. So leaving out those critical pieces of information sometimes leads us down the wrong path or away from the right path. And it's a challenge. And then you layer on top of that the language differences that we have in a city as multicultural as Los Angeles and Glendale. People that have different cognitive abilities, and of course the whole age spectrum. I mean, it's a perfect storm waiting to happen every day in the ER, but that's what has attracted us to this specialty, as well as just the broad spectrum of the social strata that we deal with. I go to work every day, and in one bed I may have a homeless gentleman, and right next to him is the CEO of a major corporation, both coming in with chest pain. And it's nice to sort of have that daily interaction with all human beings. So I think it's a combination of the intensity, the variability, and the social spectrum that's very varied.
And at the end of the day, we are all just human beings.
We are. Especially when you're sitting in that bed.
Right. When we come back, I'm going to play a game with Dr. Cardillo called Name That Illness. And I hope you're paying attention to everything he said. Information is key. The more you tell everything you know to your doctor, your nurse, your healthcare provider, the quicker they can save your life. We'll be right back.